everybody, welcome to my talk today. Tips to help you prepare for a UK charge nurse or nursing sister interview. Welcome to my talk. I hope you find it helpful. There'll be lots of tips, and do check out my other videos on my free YouTube channel, Support and Career Development for Nurses. If you're looking for tips to write a personal statement and to look at other career pathways, there's lots of videos out there and they're all free. So I hope you find this session helpful. So today I'm going to go through some background research that will help you when you're systematically preparing for a UK charge nurse or nursing sister interview. Talk about what to expect during your interview, how to prepare for interview questions, and dealing with nerves and learning from interview feedback. First thing to say is a nursing sister or charge nurse in the United Kingdom there's a wide variety of these roles across a range of fields and clinical settings, and it may be adult nursing, mental health, children's, learning disability nursing. Looking at the settings, there's hundreds of different settings where you can work in such a senior role: community, hospital, care home, general practice, hospice care, public health, military, prisons, and many, many more. There's also hundreds of specialisms, as there is internationally across nursing and medicine. So we have acute care areas, medical care areas, rehabilitation, ICU, HDU, and it ranges across all the fields. So you may work with people who are currently homeless or within addiction services, for example, when you're looking at mental health. There's lots of specialisms linked to specific conditions and medical conditions such as cardiac, renal, neurosciences. So do check out what is available across those field settings, and remember that you may be able to move across services, fields and settings. So you may work in a rehabilitation area but wish to move into the community or into addiction services, for example. The key thing is looking at the job descriptions and the personal specifications, which I'll talk about. But whilst you're working, you will be building up key transferable skills. The key transferable skills and responsibilities of a UK charge nurse and nursing sister are similar to international senior nurses. You will have leadership and operational responsibility in some capacity for a team, to deliver a service, or within a community caseload setting. Effective budgeting is usually a responsibility, and budgeting of resources and looking at safe staffing. There will always be an element of promoting quality and safety, which means you have to adhere to UK, local and national legislation, policies, standards and evidence-based practice. And I'll indicate in a few slides which are the key websites to look at regarding quality and safety, especially if you're an international nurse and applying from another country potentially. Much of the role is similar, but the policies and guidelines may be different across countries. Promoting effective collaborative team working. So people management and support and well-being is especially important in the role, and supporting and professionally developing staff education and looking at assuring compliance with statutory mandatory training and staff education. There will be other responsibilities, but those four themes tend to go across most job descriptions and personal specifications in some capacity. So when you're looking at preparing for an interview for a charge nurse or nursing sister, you are going to be asked questions about the role that you're applying for and the specialist field. A key tip is to book an informal visit to go and visit the area, to talk to people that are recruiting or people that are currently working in the role. If you cannot visit or they don't have the capacity to offer an informal visit, you could potentially book an online meeting, virtual meeting, and ask similar questions. Review the job description is the next thing, and personal specification. On a UK job description, it'll have the key responsibilities. So review the job description for key words so you understand what the words mean. And the personal specification will have key areas that are essential for the role and some that are desirable, personal specification that's desirable. If it states essential, you cannot get shortlisted for that role. So if, for example, it said that you had to have a specific leadership course or a specific specialist nursing course to do that role as an essential, then you won't get shortlisted if you have not completed that course, for example. Whereas if it says desirable or working towards or equivalent, then you don't necessarily have to have that as an essential. It could be desirable. Another key thing to do is to review the employer intranet site. So most employers have online websites, and it's really helpful to look at the employer values, their mission statement. So it might have compassion, respect for people, because you may be asked questions about what you know about the mission statement or the targets or the values of that employer. Also, research the specialist field that you've applied for, especially if you're crossing over to another specialist area, for example, and look at the national standards, the quality standards relating to that area. So if you were, for example, going for a nursing sister or charge nurse post in stroke care, there are national standards and targets for stroke care. And talk to relevant experienced staff in that area. When you're booking informal visits or a virtual meeting, try and book them as soon as possible. And when you meet them, you can talk to them about the role, about the challenges in the role, what they enjoy about the job, and about the future of the service. And those sort of insights will help you at interview. You can even mention that you've been on an informal visit or that you had a virtual meeting with a manager to increase your insights when you're interviewed for your role. The next thing is to look at key terms and structures relating to the role. So healthcare terms and definitions, you might see them in the job description or personal specification, but you need to understand what key terms are surrounding quality and standards, clinical improvement, clinical governance, so that if you're asked about clinical governance or risk assessments or audits, as a question in an interview, you know exactly what it means. I know people that have been to interview and were asked how they ensure evidence-based practice, and they just went blank in the interview. They knew it, but because they were so nervous and they hadn't had a look at terms beforehand just to revise them, they forgot at interview. So it's very helpful to revise those key terms. Also, teaching and supervising others, professional development and training. What is the key training and development that's linked to statutory and mandatory training? And when you go on the national and local websites, you will see what is required in linked to training and development, for example. Also, terms that link to leadership management, or it could be a role that links to health education or promotion if it's linked to public health or in the community. My book, How to Prepare for Interviews and Develop Your Career, is helpful. I've got lots of tables in that book that summarise some key terms and also the key institutions that you might be linked to within the book. So the other thing to think about is the structures and roles that you'll be working within the UK linked to healthcare. We have currently 4 nations in the UK, and we have different websites for each. So for example, I work in England, so we have NHS England, we've got NHS Scotland, we have NHS trusts, and integrated care systems is a new term that's come in to England, and integrated care systems are partnerships to bring together providers and commissioners of NHS services across a geographical area with local authorities and other local partners to collectively plan health to meet the needs of populations. So all parts of England are now covered by one of 42 integrated care systems, and this is a recent development. Now in the future there will be other potential structures because our NHS and health and social care is always evolving, but the principles within this talk, this is June 2022, will be the same, to understand what the current structures are in which you're going to be working. You could be working in a private institution. The Care Quality Commission and the National Institute for Health and Care Health Excellence, are so called NICE as an abbreviation, is also really helpful to review. So when we're looking at your role, you'll be adhering to national safety standards and professional standards, and there is also local and national key performance indicators. You could look up your local evaluations, any audits in the local area, and any recently published CQC reports. If you were asked about standard setting or quality, you could even mention that you've recently reviewed the CQC report from that area. So it's helpful to do. It's also helpful that if there's certain weaknesses in an area and with an employer, that they may be wanting you to do some work in that area if you're offered the role. So it may be that your questions at interview may be linked towards some of the issues that came up in a CQC report, for example. So it's very helpful to do. And also look at national risk assessment, incident reporting tools and guidelines. And these are usually published on NHS websites and on local employer websites. Because you may be given a scenario-based question of what you would do if something goes wrong, and you need to know what the escalation policy would be that you would go and report, and how you would report and who to. So that's helpful for scenario-based questions, just to revise that prior to interview. We have the Mental Capacity Act, deprivation of liberty safeguards that potentially are going to be changed to liberty protection safeguards. So for mental health, or if there was a patient or an individual staff member with deteriorating mental health, it's helpful to look at those assessment guidelines, for example. So do look at, there's lots of different risk assessments that you can review prior to interview. Some other really helpful websites to look at linked to national standards and government targets. The National Institute for Health and Care Research has standards and indicators section, and a quality standards topic library. It's like a directory of an A to Z. So it's very helpful to look at, and currently there's over 200 quality standards and indicators. Now in the future, some of these websites may change and they might use different terms, but the principles are the same, to go on those national websites for quality improvement. And when I went in last night into the standards and indicators topic library, there was over 200 quality standard indicators, and some examples. I saw abdominal aortic aneurysm, acute heart failure. So if I was applying for a nursing sister or charge nurse role in cardiac specialism, I would be looking at those particular quality standards, because I would essentially be ensuring that they were delivered within my area. So you could go through those quality standards and look to see what is linked to your specialist field. For mental health, I saw a standard on violent and aggressive behaviours in people with mental health problems. And the standard covered short-term prevention and management of violent and physically threatening behaviours among adults, children and young people with mental health problems. Now, if you currently already work in certain areas and you're applying in the same specialism that you work, you may already know what the key standards and quality indicators are. But if you don't, it's definitely worth having a look and reviewing these websites. Another key website is National Health England and NHS Improvement, and they identify a number of core clinical priority areas where improvement is expected and indicators are specified. So, for example, I had a look last night and there was an indicator supporting patients to drink, eat and mobilise after surgery, ensuring that 70% of surgical inpatients are supported to drink, eat and mobilise within 24 hours of surgery ending. So that's a national indicator. So if you were applying for a role that links to a surgical area, you should know that that is a specific indicator, quality indicator for that area if you're applying for that role. Another good website is to look at the Commissioning for Quality and Innovation scheme, and the sequin indicators and targets essentially that it's a payment framework that enables commissioners to link a proportion of providers' income to the achievement of quality improvement goals. So essentially it's financial incentives for institutions that are providing services, and there's different goals to achieve to meet those targets, and those indicators will have financial incentives linked. Other background research. So you need to understand the team that you're working within and the responsibilities, and understand the roles of everybody in that team. And if you're unsure, ask or email for clarification. Some charge nurses and nursing sisters are responsible for an administration team as well as a nursing team, support worker team. It might also link to allied health professionals. So which teams are you responsible for? And that could be in the community, in public health, or in a hospital-based setting. It could be wherever you work. Also looking at hot topics that are current, so reviewing topically what's going on in a field or a profession across media and professional journals. So for example, over the last few years there's been a lot of questioning about COVID and staff well-being, or you may be asked to discuss a contemporary practice related subject in any other area, whatever's going on currently. Transferable skills. It's very helpful before your interview to spend some time reflecting on the key differences and similarities between your current role and the role that you're applying for, and looking at transferable skills that you currently have and some practical examples to demonstrate your skills. As I mentioned earlier, the key responsibilities are managing, leading, organisation, supporting staff well-being, educating and training and having that compliance with national statutory mandatory standards, looking at quality standard setting and providing quality care, looking at collaborative, effective, positive team working, and clinical academic work, research or publications that show, achievements that are highlighting your achievements whilst you're in your current role. And that's very helpful to have those ready and prepared beforehand so that you could potentially get them into one of your answers at interview. To help you prepare some practical examples and to think about some good examples, I have 2 YouTube videos. One, 5 ways to influence nursing practice, and it's where you can show off your leadership skills, organisation, management skills, and in lots of variety of ways in your current role. And then I've got a video on quality improvement and service improvement projects for nurses. So this is very helpful. You may want to collaborate with a project or lead a project. And also, if you are not successful for a role, I would highly recommend having a look at these videos and starting to align some of these skills in your current role. So it gives you examples of ways that you can really sell yourself for interview and demonstrate key transferable skills for applying for leadership roles such as a charge nurse or a nursing sister. So I hope you find those videos helpful as well. So the type of interview and format, this will be dependent on the employer. Always check your invite letter to your interview, or ask the human resources lead if you're not quite sure. You may have a straightforward panel-based interview that might be virtual or face-to-face. Or you may have a 2-part interview where you have a panel interview called a technical interview, and then a value-based interview, which I'll talk about later. You may also have a short presentation, and often with a higher banded role, such as a nursing sister or charge nurse, you'll be asked to deliver a presentation because the role is competitive and they're trying to differentiate the strengths of different applicants. If you do have a presentation, I have a YouTube video, how to prepare a presentation for a senior nurse interview, band 6, band 7 nursing interview on my YouTube channel. So do check it out. Lots of helpful tips. Preparing for your interview. So as I said, it could be face-to-face, online, it could be a couple of hours long. You might be asked to do some group work, some scenario-based exercises, or it could be a straightforward panel-based interview, or you may have a presentation. Do check out the invite letter, and if you check your invite letter on your phone, I do know somebody that didn't carry on scrolling on their phone and didn't realise there was a second part to their interview, so they didn't prepare a presentation. So do make sure you check that letter for what you've actually got to do at interview. Pre-checks, be punctual, always check the location, the travel links, and nowadays it's the online internet connections. If you have a poor connection at home, then try and book a room at a library or in a university institution, or wherever you work, they may have a quiet room, to make sure that you've got good connections. Also, try not to do the interview on your phone when you're holding your phone. It is much better to have your phone held up so it's in a stand, for example, if you're going to have to use your phone, so your hand's not getting tired and the screen's not moving around, or use your desktop, and try and make sure that the camera's still and there's no disturbances. Value-based interviews. So a value-based interview aims to select individuals who align closely to the values of the organisation or the NHS. So that's why I said at the beginning, if you have a value-based interview, always check the employer website for their values, because it will indicate some of the sort of questions you might be asked. You'll usually start with a value-based interview. You have 2 or 3 questions only. And then there is more probing questions where they drill down on your responses. So an example might be, give me an example where you have improved the quality of patient care in a clinical role. You have to think about a past role where you have done that, where you've improved quality. They do not want you to talk about something you have observed. It should be something that you were involved with, that you proactively did yourself. And then you may be asked other questions. So example might be, once you've described what you did, how did you evaluate whatever you talked about in this situation? Or how did you know that you improved the standard of whatever you were talking about? So the extra questions really are going to be getting you to give further information on what you talked about earlier. Value-based interviewers expect a relevant example that demonstrates your practical application. And if you don't have specific detail and you just give a one-sentence answer, you're going to be rated as low in a value-based interview. So you want to not talk too much, so you don't want to keep going on and on describing. You want to be quite factual and specific. And I often say to people, if you're preparing for an interview, choose and reflect your best practical examples before interview. But when you're talking about your example in an interview, try and keep it like you would if you were writing a factual incident report, for example, because you don't just write loads and loads of description. You would be stating facts as much as possible. And that's helpful to focus you down when you're giving your example. What do the interviewers want to know? So there's three things. The first thing, that you understand what you have actually applied for, which is why when I talked about systematically preparing for the interview, that you actually know the team that you're going to be managing and leading, the quality targets that you have to meet, the type of service and specialist field that you're working in. Because often the first sort of questions will be, what do you know about this specialist field or the area or the role? Or they might just say, why have you applied for this role? What quality standards do you need to abide by or adhere to? They might ask you, what targets does this service need to aim towards? What quality targets or quality improvement standards? Which teams or roles are you responsible for within this service? And it's interesting because I've been on many interviews with charge nurses and nursing sisters, and they may forget about support workers and admin staff and think it only focuses on registered nurses. So they have this lack of insight into what that role actually entails, and the variety, the team, the whole team that this person is going to be responsible for. So it's very important that you find that out. Now in the job description, it'll probably be in there exactly which teams you're responsible for, but some people don't read the job descriptions thoroughly. How will this role differ to your current role? You might be asked, will you be able to manage the additional responsibility in this role? Well, if you don't know what the additional responsibility is and you haven't checked for what you're currently doing to what you're being asked to do if you're offered this role, you need to have compared the two roles, your current role and this role. That will really help you answer that question. How are you going to achieve a healthy work-life balance? Somebody that's appointing you needs to know that you can cope with the workload in that role and that you've really thought about and understand what you've applied for. Second thing, they want to know that you've got the knowledge and skills to do the role. Do you hold the right values and skills? Do you have the potential and willingness to develop your leadership skills in the future if needed? Do you communicate and collaborate positively with others or in teams? Can you cope with future challenges or it could be changes in the service? So if you don't know what's planned for that service or what the service priorities are, you're going to find it difficult to answer that question. So, which is why I mentioned earlier about looking on the employer websites, talking to people currently in the role, checking the job description, and that will help you, because you can also ask questions at an informal visit, or if you book a meeting with the recruiter beforehand, or you might have to email them and ask them a few questions, so that you've looked up what potential challenges there may be. I know services, for example, where the service is planned to integrate two specialist areas together, and it's on the website and it's in the job description. but they haven't looked at it and they didn't understand that that was going to happen. So it's helpful to, when you're on an informal visit, to ask, what are the plans for this service in the future? Is there any changes being planned? Thirdly, that you are the best candidate for this role. So questions will be asked to differentiate between candidates, and they mainly will link to the job description and key transferable skills, and they're the specifics of the role. They could be scenario-based questions. Now, these scenario-based questions are going to be a question of something that you've got to do in that role. So it's going to be linked to those key areas of leadership, organising, quality standards, safety, teams, collaboration. So I've got an example here. What would you do if 2 of your team leaders stated that they could not work together anymore? So your role would be to try and promote positive working. So thinking about these sort of questions and how you would answer that question is important. So looking at a few more generic type questions, you're going to be asked something about understanding the role, the service, the field. So why have you applied for this charge nurse sister role? They may do quite an open question. Tell me a bit about yourself and your aspirations. What led you to apply for a role in this area or within this service? Tell me what you know about the ward, the community setting. It could be about the patients or clients that you're caring for and prioritising their needs. It could be the type of nursing. It could be to do with the team that you're leading or the service, some aspect of the service that you're delivering. What key quality standards or quality improvement indicators link to our service? What do you think you will need the most support with if you're offered this role? And what challenges do you envisage in the role? So having your informal visit to talk about potential challenges and what's happening in the future would be helpful to answer that question. When you're looking at what support you might need, it could be that you don't work in that service currently and they're looking at weaknesses really, and your weakness would be that you don't work there currently and you haven't met the people that you'll be working with. But you talk through how you would overcome that challenge would be accessing support and booking meetings with the key teams and leads that you'd be working with, team members that you'd be working with. So you have a think about how you would address gaps in your knowledge or challenges. You may also be asked questions so that they assess your knowledge and skills. So what transferable skills do you hold that link to this role? So the exercise I mentioned earlier is very useful to look at your current role and then the skills that you can be transferable to those key responsibilities to work as a charge nurse or nursing sister. They could ask you to give an example where you have recently evaluated care or promoted quality standards. It's just dependent on your job description really, and thinking about not just what you did but how it impacted on others, and that could be staff, patients, clients, carers, and how you evaluated it. Can you give me an example where you've led a team, influenced change, promoted quality standards, or delivered a project, for example, that will demonstrate your leadership skills? What challenges or barriers to achieving an aspect of the role do you think that there may be? So if you've got good insight into what you have to deliver in that role, you can think about those challenges and how you would overcome those barriers. And it's helpful to go on your informal visit to ask about future changes in the role and what the key challenges are in the role. So I've got some example scenario questions. So the first question really is about managing an issue with a staff member at work. So something's gone wrong, and in this case you found a staff member drunk, and you've got to think about health and safety. You have to think about adhering to policy with any sort of people management. It's about being empathetic as well and compassionate, but ultimately you have got to ensure that the patients, clients, other staff under your care that you are leading, your team, are safe. So have a think about, some example questions where things may go wrong, where certain team members don't get on, or there may be breakdown in communication. But this is an example here. And think about the policies that would link to some of these scenarios. How would you address poor compliance with staff mandatory e-learning across the service? Now, the difference with a junior deputy or an early career nurse is they don't have global responsibility and for organising and leading and assurance. So you need to think globally when you answer questions, not just on registered nurses, but on the whole team that you're working with. So think about strategies that are effective, linking to staff resourcing as well. A medic comes down to the ward and demands that you open 4 additional beds immediately due to pressures in his pre-operative clinic. So again, it's adhering to process. So what would happen? So if you have got if you are looking at applying to a service, if you've already talked to people in the area about what the pressures are, you can potentially ask these sort of questions, like what would you do if somebody asked you to open more beds? You can talk to floor coordinators and ward coordinators. If you're in the community, you might have a slightly different scenario, but it could be relating to services and resourcing. A community nurse in your team is reported for swearing at a support worker during a community assessment. What do you do? So you're adhering to performance management policies, you're finding out what's going on from each of the individuals and using a sort of professional, unbiased approach, talking to everybody involved, taking statements from people potentially. So, but have a think about these sort of questions. Half of your team have rung in sick with COVID. So this is like a staffing issue. What do we do if we're down on, what's the process? What do managers currently do in your area where you work if there's staffing issues? So by trying to align your experience prior to interview, where you're shadowing sister or a charge nurse prior to interview, and you're really gaining insight into what they do, and it's about managing, problem solving and making those informed evidence-based decisions. So that's some questions. And then lastly, dealing with nerves. So it's normal to be nervous before an interview, and interviewers expect this. It doesn't matter what level of nurse you're on, what job you're applying for. If you are excessively nervous, let the interviewer know, because they can support you, get you a glass of water, get you to take a breath. Interviewers should want the best out of those candidates that they're interviewing. And remember, you've done very well securing an interview, so that's fantastic, because you've done a personal statement, written a personal statement and an application that is good enough to be shortlisted, because there'll be many people that are not shortlisted for such posts, because there's a lot of competition, so often they can't shortlist everybody. Interviewers are human and they want you to do well, so always ask for more time if you go blank in an interview. The more you prepare, the more confident you'll feel. I went for, I think it was 3 sort of senior nurse team leader roles many years ago, and it wasn't until the 3rd interview that I was really confident to answer those questions, and having gone through 2 interviews previously, it meant that I could build up my confidence, my knowledge, and it was about the preparation. So with each interview I learned a bit more. And you don't know who else is applied for the interview. So there could be somebody that is already a nursing sister that has actually applied. So they'd be in a very strong position to answer questions if they're already in the role. So don't let it reduce your confidence if you are not offered the role. But the more you prepare, the more confident you will feel. You may want to use mnemonics or memory aids if you think you might go blank because you're so nervous. Just do your best and put that interview in context with the whole of your future career. You can apply for more posts and you can go for another role elsewhere if needed. If you're not offered the role, make sure that you request verbal feedback from an interviewer. Employers are not necessarily obliged to offer written feedback currently. It's June 2022. But when you are given feedback, if you're not offered the role, sometimes you can be so disappointed, you just put the phone down and you don't ask those questions. It's very helpful to ask the person while they're on the phone, how could I have improved my answers? What was my strongest or weakest answer? And that will help you if you go for another role. Don't spend time and energy dwelling on what if. It's not worth it. Just reflect on your interview feedback to inform your future preparation. A key tip is to write the interview questions down and feedback, because you may forget when you go for your interview again, and it's helpful for your next interview. And it's also very helpful to book a mock interview with a senior nurse when you go for the job again. And it's perfectly ethical to have a mock interview as long as the person offering the mock interview is not on the interview panel. And also you need to give somebody a lot of notice, especially if they're a senior nurse, to book them in. So I would say when you put your application in for a sister or charge nurse role, I would be on the same day emailing senior nurses that you think, or educators that would be able to provide that mock interview if you want the chance to be booked. So the key tips to success, just to summarise: align your past and current experiences, allow time to prepare for your interview, never presume the job is yours, and always ask for interview feedback if you're not offered. And the key one is preparation. If you don't want to put comments in the YouTube, you can contact me directly or DM me on Twitter or Instagram or on my website. So I wish you every success at interview. I hope it goes well for you, and I hope that you found my tips helpful. So good luck.